First up, I would ask to the stage Ms. Shantae Morton from Carolina Health Systems. Come on up. I came across her name because I'm one of those odd birds that likes to read the paper, and I even read the Lakelands Connector, and I saw her picture there holding a big old check. You can see it here in this photo here, where the Greenwood Community Something Foundation, they're issuing money left and right for people. So she was able to be part of that on behalf of Greenwood County, and so she has some things she would like to share with us today.
Good morning. Good morning. I'm delighted to be here this morning. Thank you to Mr. Kilmer for inviting me. Today I'm going to talk about Choose Well, which is a South Carolina initiative that Carolina Health Centers is a part of. It's a grant that we was awarded back in 2018 for uninsured and underinsured individuals. So, as Mr. Kimmer said, I am Shantae Morton, and I work with Carolina Health Center, and I've been there around 10 years, and before that, I did some work with the South Carolina Department of Corrections. So my presentation is about 15 minutes, and I'm pretty informal. So if you have any questions, just raise your hands. I call on you, and I'll do my best to answer your questions, okay? So the program is Choose Well, and Carolina Health Center is a partner Choose Well program funded by New Morning. So the program initiative is so generations can discover that they have a say in family planning as far as birth control. I know a lot of homes do not talk about birth control, let alone talk about sex. So we're trying to initiate where unplanned pregnancies have decreased in the state of South Carolina. Not only women take into account, but also men. So future generations will one day struggle to comprehend that there was a time when people got pregnant unintentionally. Consequently, they will know greater personal freedom, wider economic equality, and an unparalleled degree of family stability. Nearly every societal problem they face will be rendered more manageable as a result. This is why Choose Well exists, to improve lives by eliminating unintended pregnancies. A collective of individuals working across countless disciplines, we are creating a model for a better way. We're united by this vision of future and the belief that sweeping societal change can only be accomplished human to human. So my first question to you, how many of you are familiar with birth control? Okay, can I get someone to talk about, when you hear birth control, what comes to mind? Birth control? Pills. Okay, Depo-Provera. So birth control pills are number one as far as being popular. But with Choose Well, we try to implement a highly effective method, which means something that lasts longer, that people don't have to take every day. I have a question. When we talk about birth control, do you think vasectomies are included in?
I do.
So for those that didn't know, it takes two. Right? So we're going to put some of the work back on men. So vasectomies are also covered by Choose Well for uninsured and underinsured. And before you cringe, vasectomies are now scalpelless, meaning, the men don't have to worry about going in and, getting cut. It's a scalpelless procedure. So back to birth control pills, we do cover birth control pills. Birth control pills are considered a moderately effective method. Long-acting birth control is considered IUD, which is something that's inserted inside the uterus. Also Nexplanon, which is an implant. Those devices last 3 to 5 years. We also have an IUD called Paragard that's non-hormonal and it's copper and it lasts 10 years. Okay? So any questions about birth control for men or women so far? Okay.
I have a question.
Okay, sure.
As somebody who did have a vasectomy years ago, when did they invent this scalpeless technique? I want to know why wasn't that around?
Well, I found out about it in 2018, so. Yeah. So improving contraceptive care services. Choose Well mission is to increase access to contraceptive services for all South Carolina's women and men. Partners across the state have made great progress in providing these services to women, but contraceptive care services for men, including sterilization, have been more limited. Yes, ma'am?
I have a question.
Hold on, Lee.
Oops, sorry.
I want to make sure everybody can hear your question.
Do you only cover it for birth control methods for birth control, or would you cover them for health reasons? Like endometriosis and stuff.
Okay. So the initiative is for family planning. Okay. And the age for that's considered family planning is 15 to 44. So if we have an individual that comes in that needs birth control pill for other reasons, then we have other programs that will assist with that.
Thank you.
You're welcome. What Choose Well means to our community. Individuals can stop stressing about getting pregnant or paying for birth control. Right now, any woman in South Carolina can schedule an in-person or virtual appointment, and a provider will meet with you one-on-one to help you choose the best birth control option for you. So, have you ever rode around and saw the billboards that say, no drama, or just because you're $1 short, you don't have to be a day late? That's us. Because we're providing free birth control pills or whatever you choose. It's up to the individual, regardless of your financial status. If you're uninsured, it's free. Underinsured is free. Also, if you're in a situation, domestic violence situation, and you don't want your spouse to know that you're on birth control, we're gonna give it to you. It's free. So regardless of what you have going on, we're gonna make sure you're on some type of birth control option. So for unintended pregnancies, what do you think that does to our community? For individuals who are uninsured or maybe unemployed, and they have a, oops, I'm pregnant. What happens?
Jobs raised in an environment that's not conducive because of income lacking.
Okay. Anyone else?
It impacts the economics of the family and of that child and access to resources.
Okay. All of those are true. Unintended pregnancies can handicap a household financially, emotionally, and it dampers raising your children in a more healthier environment. So if you have a planned pregnancy, you're able to plan other things as well. Your finances, your support system, things flow better. So that's why Choose Well wanted to implement birth control options for those who are uninsured, underinsured, so they can have a better chance at accomplishing their goals or their dreams. So for the uninsured and underinsured, that's Choose Well. I'm also a navigator. Today is April 1st. Medicaid is unwinding today, meaning people who are on Medicaid, if you're not checking your mailboxes, it's a good chance you're going to lose coverage. During the pandemic, they paused Medicaid eligibility review. Now that we're out of the pandemic, or functioning better through it, Medicaid is starting to do their review process. Many individuals in the South are going to lose coverage because they're not checking their mailboxes and they're not filling out their application to renew their Medicaid coverage. That opens the door for special enrollment for the Affordable Care Act, the marketplace. Did y'all know that Medicaid was unwinding today? In addition to that, we did not expand Medicaid. So there's going to be a bigger gap of uninsured individuals in our state. Okay? In addition to that program, we also have an HIV PrEP program. We are in the process of trying to move the marker to decrease new HIV cases in the Southeast. By doing that, we are asking more questions during the workup in the clinic to determine if individuals have high-risk sexual activity. If they do, they are recommended to get on PrEP, which is a prophylaxis to decrease contracting HIV. That's our mark on how we're going to move the marker to decrease new HIV cases in the Southeast. Do I have any questions about Choose Well, me being a navigator, or HIV PrEP?
Well, I had a question. I want you to explain how long after you lose Medicaid do you have to apply for the affordable health care?
Okay, so special enrollment for anyone who loses coverage, you have 90 days after your coverage ends to apply for special enrollment through the marketplace. Okay.
Could you do me a favor and define underinsured? Because a lot of people don't know what that phrase is, and it encompasses a lot more people than we realize.
Underinsured, you can have insurance, but your insurance might require a PA, a prior authorization, which could take weeks or a month. So at that time, insurance would not cover something because they need a prior authorization from your provider, which is your physician, that is underinsured.
Thank you. Those are great questions. Shantae, is that it?
Yes, that's all I have.
Wonderful. Thank you, everybody. Thank you, Shantae. Very, very well. If you take away one thing from that lesson to us, we have family members, we have children, we have grandchildren who are approaching that age, and you need to let your neighbors know, your family members know that services are available, and grants have been provided. It's a wonderful program here in Greenwood County. You now know a name that we can reach out to, and if you forget her name, you have it on your agenda, but we have a resource we can go to for this type of service. We like to try, people like to say, all of that stuff should be left up to the parents. That's a private family thing. We don't need to be, having agencies and the government getting involved. Well, let me tell you, not every parent is versed on the subject or even willing to speak about the subject. I'll share with you the one sex ed lesson I got from my father was the night before I moved off to college. And I'm up late, I'm watching TV, I'm kind of nervous. He comes down, he sits on the couch, you can tell he's nervous. And he says, well, Billy, that's what he called me, Billy. He says, you're about to go off on your own and you're going to be making your own decisions, and I'll just share this with you. Don't go putting things where they don't belong. You know what I mean? I'm like, yes, Dad. And he went back upstairs. That was it. So not everybody has the parental structure to provide meaningful and useful education and guidance. So we're blessed to have people like Shantae fill in the gaps where needed and provide a true community service.